Welcome to the TwoRescuer BLS and CPR for adults. In this video, we'll discuss the TwoRescuer BLS process and CPR steps. Many times, there will be a second person available who can act as a rescuer. The ILCOR emphasizes that cell phones are available everywhere now, and most have a built-in speakerphone. Direct the second rescuer to call 911 or your local EMS number without leaving the person while you begin CPR. This second rescuer can also find an AED while you stay with the individual. When the second rescuer returns, the CPR tasks can be shared. The steps for CPR are similar between one rescuer and TwoRescuer BLS. However, there are some slight differences. Let's review the TwoRescuer CPR steps. For the first step, have the second rescuer prepare the AED for use. Next, deliver chest compressions, counting out loud. Then, have the second rescuer apply the AED pads. Have the second rescuer open the individual's airway and give rescue breaths. Switch roles after every 5 cycles of compressions and breaths. One cycle consists of 30 compressions and 2 breaths for adults. Be sure that between each compression you completely stop pressing on the chest and allow the chest wall to return to its natural position. Leaning or resting on the chest between compressions can keep the heart from refilling in between each compression and make CPR less effective. Rescuers who become tired may tend to lean on the chest more during compressions. Switching roles helps rescuers perform high-quality compressions. Quickly switch between roles to minimize interruptions in delivering chest compressions. When the AED is connected, minimize interruptions of CPR by switching rescuers while the AED analyzes the heart rhythm. If a shock is indicated, minimize interruptions in CPR. Resume CPR as soon as possible with chest compressions. This concludes our lesson on TwoRescuer BLS and CPR for adults. Next, we'll review adult mouth-to-mask ventilation.